All right. Hi, Court. Thanks for joining us today.
Of course. Thank you for having me. It's a pleasure.
Well, Court, you're such a good friend and someone who I have always admired and looked up to immensely. So it's really such a joy, and I feel very humbled to have you on with us. And so for today, we're going to keep it short for our audience. There's so much that you've done with your life, but today we'll focus first on your career journey and decisions, and then we want to get your take on AI and healthcare, and then we'll wrap up with some rapid fire questions. How does that sound?
That sounds perfect.
Awesome. Well, let's dive right in. So you've worked at McKinsey in venture capital as an investor at Google. What's the through line for you? What questions or values have guided your career decisions?
Yeah, this is something I've thought a lot about through my kind of winding journey that's gotten me along the path that I've ultimately taken. At its core, I'm really driven by intellectual curiosity and by kind of taking the opportunities and the privileges that I have and really using those to give back to the communities that have created those for me and to be able to really maximize my impact in this space. And so, instead of going right to medical school after graduating from Princeton, as you know, I decided to defer and spend some time at McKinsey, which was really important to me to be able to understand the landscape of healthcare from beyond the walls of the clinic or, the operating room. And my master's then in the UK in medical sociology was really an opportunity for me to think deeply about health equity and think really deeply about kind of where, how have we gotten to where we currently are, understanding and questioning, and ultimately being able to hopefully be positioned to address some of these inequities that are unfortunately so ingrained in so many of our systems, but particularly in healthcare in this country. And then more recently at Google and at Aegis, I've had the opportunity to see how transformative technology can be when built and implemented thoughtfully in addressing some of these challenges. And throughout all of this, my goal really has just been to understand the systems, the practices, and the science behind healthcare from as many angles as possible, so that then I can ultimately maximize that impact, be it from within or outside of the hospital.
Well, thanks for sharing, your many different sort of parts of this journey. And I can tell you really have such a nuanced take on healthcare. And so that's kind of the transition. You've seen healthcare from such different angles, from tech, from venture, from consulting, and actually practicing. Where do you think AI is making the biggest real impact in healthcare right now? So not just on the slides, but truly on patients and workflows.
Yeah, that's a great question. Like you said, there's so much opportunity, and I think a lot of kind of the sexy stuff that people initially think about when we think about kind of AI in healthcare is patient facing, and there's certainly so much opportunity there. But I think, from what I've seen practically, particularly, as we're in this early stages of AI adoption, I really think back office automation is a space to watch. Because as you know, probably better than anyone, healthcare technology is such a hard space to play in, as you think about HIPAA compliance, the ever-changing reimbursement legislation, legislative landscapes. It can make implementation and adoption really challenging. And I think also in reality, it's hard to, disrupt patient-facing technologies. It's hard to disrupt provider workflows. Folks get really ingrained in these kind of patterns and practices they've been in for decades. But I think when you instead focus on leveraging AI to create free up capacity and drive provider efficiency, particularly in ways that aren't requiring that behavior change in mass, I think that can really be there can be a lot of value there. And we're seeing that, be it with prior auth or with staffing, but I think that's really a way to unlock a lot of value in healthcare through AI without having to go through some of those hurdles facing the industry.
And on the note, you alluded to these, hurdles. There's also a lot of noise in AI in healthcare. What are signs that you look for, to see, okay, a product is actually working? And around the hurdle point, are there any red flags you look for as well?
Yeah, absolutely. And, potentially kind of biased here, thinking about kind of end adoption and in a case where in a lot of times, that is physicians, when we're thinking about kind of clinical technologies and kind of innovation, but ultimately, for a product to stick around, like it has to be adopted by the end user. And, in this case, so frequently that, is physicians and is other providers. And so I think an early red flag for me is anything that's going to disrupt those provider workflows or make it harder for physicians to, ultimately care for patients. And I've seen so many products that I think sound great in theory, but they just don't get used because the, clinician or whoever's using it, even though it might be designed to make their lives easier, in the moment they feel like it's adding another click or it's adding another step or otherwise slowing them down. And I think this is particularly evident with anything that kind of is integrating with EMRs. I mean, these systems are so overloaded, already have so much data and are unfortunately largely very user unfriendly, which is something that I've got to see firsthand this past year in the hospital. And I think once folks get used to doing things a certain way, it just can be really hard to change that. And I will say, I've certainly seen exceptions to this, and one of which is actually a tool we use at Penn that has transformed the way that we do care handoffs and the way that the system really works. But it's certainly not an easy path to get to that point.
Well, I agree. The path for startups to get to a point where we're actually creating value for doctors is hard, but also, your own professional path is incredibly, challenging and inspiring. And so if you were to actually go back and advise your younger self or someone who's watching, who's graduating now, and who's torn between consulting, tech, venture, practicing medicine, how would you help them think through the choice?
Yeah, it's, so important to be thoughtful and intentional, when it comes to decisions like these, because there are so many opportunities out there. And unfortunately, we don't have unlimited time. And I think as I reflect, one really important starting point is whether you want to kind of build or advise, which you can also think about as, do you prefer depth or breadth? And what I mean by that is if you're more excited about depth, you're more excited about being, really in there in the sausage making and seeing the downstream impact of your work, then I think you might be better suited for a role where you're embedded within a company. But if you're really drawn to breadth, being able to work across different projects and companies, and you're not as attached to seeing the fruits of your labor, then, maybe consulting or venture could be a really good fit. But I also ultimately don't think there's a wrong decision. I think there's so much overlap in the skills that you build and the opportunities that you can have that I think you can really shape anything into what you're looking for. You just have to be, proactive and intentional. And I think I've seen, through my winding journey that ultimately, you can do what you want to do from any angle. It just might, you might just have some journeys along the way.
Well, that's advice I wish I had heard when I was 22, but still so, so relevant. Now, maybe we can wrap up with some rapid fire. You ready?
Let's do it.
Okay. What is one healthcare company, beside turmeric, of course, that you admire right now?
Ooh, that's a hard one. Open evidence.
You know what? I feel like open evidence has come up so much in the last week. I'm like, how do I get access? And I realized I can't by design. And now I have FOMO. So you'll have to show me next time we're together.
It has saved me many times throughout medical school. I will just say that.
I'm like, is there a company that has like fake IDs for open evidence? Because I want one.
Maybe that's
send me to jail. Okay. Next, okay. What's one trend you think is overhyped and what's underhyped?
Oh, overhyped AI replacing radiologists. And not just because I'm interested in radiology. Underhyped, I'd have to say interoperability and structuring unstructured data.
Ooh, well, we agree with that. Okay, the year is 2030. What's one thing about AI in healthcare that will feel obvious in hindsight?
Oh, goodness. Well, at that point, I'll hopefully almost be done with residency. But I think looking back, I think we'll realize that the hardest part wasn't actually building the tools, but it was getting them adopted and implemented.
Totally resonate, especially with all of the vibe coding tools out there. I think it's become easier than ever to build technology, which I think is a good thing that we're democratizing access. to like building AI and just healthcare technology in general.
Mhm.
But you're right, implementing and adopting still super hard. Okay, finally, if you weren't working in AI and healthcare, what would you be doing?
Oh, goodness. Besides maybe having an identity crisis, I think I would be in a coastal town somewhere, probably running like a hybrid wellness cafe boutique fitness studio.
Well, sign me up for whenever you make that happen. Awesome. Well, Corey, thank you so much for your time today and hope our listeners enjoyed.
Thank you so much for having me.